How water is distributed and used in the nursing field. My name is Corey Carver, and I'm a senior at the University of Arizona. My major is Care, Health, and Society with a minor in Sociology from the College of Social and Behavioral Sciences. After I graduate this upcoming December, I intend on furthering my education into the nursing field. As a male going into this profession, mostly dominated by female roles, I thought it'd be funny to implement Ben Stiller's character, Gaylord Fokker, who is a successful male nurse in the movie Meet the Parents. For this video, I'm going to be talking about different types of ways water is actually used in my future career as a nurse. Of course, water is the key source to survival and is needed for every living being in order to sustain a healthy lifestyle. Many sick patients are admitted into the hospital for such reasons of dehydration and not having the correct amount of fluids in their system to keep a healthy balance in their day-to-day lives. This is why a lot of times you are in a hospital setting, patients are usually linked up to an IV connected into their arms. An IV is intravenous rehydration that uses bags filled with water and usually a small amount of either sugar or salt, depending on what the doctor recommends for the patient's current situation. The dissolved salt is also known as electrolytes, which helps your body increase rehydration. There are drippage settings along the IV line that drips the fluid straight into your blood system from a lot to a little at a time, depending on the patient's severity of dehydration. According to WaterSense, here are the percentages on average of how much water is used in a hospital setting. The most obvious used water source is the domestic/restroom, which covers 35% of water used. This does make sense because of all the overnight patients that need bathing and use the sink to wash their hands and brush their teeth. The second most used resource is the cooling and heating systems. I know if you've ever been to a hospital, you notice how cool it is inside. This is usually because airborne bacteria and diseases can't really survive in a cold environment as well as they do in a warmer environment. So the cooling uses about 20% of water. The third most used resource for water in a hospital is medical equipment at 15%. This brings up my next point of how water is used within the hospital setting. According to the Centers for Disease Control and Prevention, also known as CDC, they have found that many skin particles from patients containing many bacteria and microorganisms are shed every day onto patient gowns, bed linen, bedside furniture, and other objects around a patient that can become contaminated. This is why all medical equipment is to be properly sanitized and decontaminated, therefore supporting the statistic of 15% of the water used in hospitals to keep all medical supplies and equipment germ and bacteria free. Not only for the patient safety, but for the doctors and nurses as well. According to the Healthcare Infection Control Practices Advisory Committee, before completely sterilizing their instruments, water is used to eliminate all visible substances off. This is the first action because if objects are still on the instrument during the actual decontamination and sterilization of the equipment, those materials will actually interfere and cause less effectiveness through the process of sterilization.